In 1947, we had the best health service in the world at that time. Now we haven't. We've got one that's inferior to many, haven't we? And even if you go back to Blair's days,
poor,
isn't it so?
Not the best medical service. My father was a country boy. He came from 15, 20 miles outside of Belfast. Okay, he told me stories of people, having lacerated themselves or whatever, working, and they wouldn't call the doctor. So my father was I mean, I nearly chopped the top of my finger off there, hanging off. My didn't go to the doctor, didn't go to A&E. So people made do, and people died. Women died in childbirth. People died from things that we would think it's an absolute scandal that if they died from them not.
Yeah.
Blood poisoning, septicemia, from cuts, from tetanus, from. No, I mean, look.
But you don't have to, knowing that, you don't have to then go to the National Health Service model. There are other models for healthcare.
There are other models, but British people chose that model, and they put the Labour government, which probably I need to remind you, ran most of the major ministries during the Second World War. So they were tried and tested, trusted, and here we are. The National Health Service is up there with the most popular institutions in the country.
Well, there's a lot of propaganda that goes into making it that way, as we saw in the 2020. And it doesn't mean it isn't true that it would be popular anyway. However, it still doesn't, although the British people can say chose it, in a sense they chose it. I mean, in the 1945 election, it was almost a 50-50 split in the votes. It's very close. It wasn't far off. A landslide of seats.
It was a landslide.
A landslide of seats, not of percentage votes.
And it was a turn up for the books. Everyone expected the Tories to
That's true.
The Churchillian.
Yeah, it's true, but it was a landslide of seats, not of votes. And in 1951, it was again closer to 50-50 when Labour won. Sorry, 1950 when Labour won again. 1951, when the Tories came in, it still wasn't a huge shift in percentages.
Yeah, but it was created by them, and people were using it.
But what I'm getting at, though, in this thing is when we say the British people chose it, it's kind of like saying the British people chose Brexit. A greater proportion of Brits voted for Brexit than voted Labour in 1945. So really, what it is...
That raw comparison doesn't work. It's a different policy area and
yes,
it's a different time.
It's about looking at percentages here. So I wouldn't say the British people chose the NHS. They voted for Labour, for which NHS was a manifesto pledge.
The Service was brought in by accident.
Labour were going to win that election even if they hadn't had an NHS proposal. If they'd have said, for example, they were going to provide funds for going to private doctors.
It was a shock result.
Well,
it was a shock result.
Yeah, but it wasn't like people saying, right, I'm voting Labour because of the NHS proposal. No. They wanted healthcare, but that doesn't mean the NHS was that they were going to vote for a particular model.
People wanted change. Okay, they wanted change.
Indeed,
and Labour,
half of them did,
including it was a landslide.
Of seats, not of votes.
The British system.
I know, but you say landslide to bolster the idea that people wanted change. Half of the British people pretty much weren't looking for change, they were voting for the Tories. Just more than a half voted Labour, so that obviously they wanted the change and they were the majority.
You're getting lost
That's how it
works.
Not lost in it.
What counts is not the percentage of the vote. That counts for the political anorex. What counts is how many seats. Okay,
that's true in terms of raw power.
That's it.
But when you say the British people voted for something,
yes.
That's not right to say that. You should say the Labour got a parliamentary majority.
In every election since then, has anyone bothered
There's no voting in the UK, man. All these votes are bullshit. You put them in a pencil and they can
that's highly cynical.
Them off and change them.
Well, that's true in the USA.
All is managed behind. It's like a big brother. There is no vote in the UK.
Has any party ever...
and not many people don't vote as well. Majority
they want to
don't vote.
abolish the National Health Service?
Oh no, absolutely not.
There you are. So that means that Liberal, Conservative, Brexit, whichever, wherever you're coming from, you accept the National Health Service is here and it delivers goods for the majority of people.
You know, I don't.
Cradle to grave.
Yeah, I think when Thatcher came in,
You have a better NHS
their
than
manifesto
America?
didn't propose, for example,
They looked at it.
abolishing,
They looked at it.
denationalising rail,
They
for
looked
example.
at privatising the BBC as well. But they were warned off it.
Oh, this is fair points, but you see, my point is there are nonetheless other models which work better than ours.
There are in Sweden, in
Unsurprisingly,
America, in China.
Simon Stevens, who I said to you has spent his life in the American
Yeah.
private health system, did some work and they've looked at this and they did comparatives with the most frequent example. No one holds up the American example because it excludes a huge chunk of people. People tend to look at either the French system
Or the Germans.
or Switzerland.
For Germany is Spain, I think.
The German system is basically like the French, so it's basically an insurance model, which you pay for your, you choose what you want, so long as you've got the money, okay? And now that's one issue. So basically, if you're French or German, and you've got plenty of money, you can go to your doctor and say, what about this? And the doctor can say, well, there's a range of consultants, there's a range of clinics, if you need surgery, whatever, how much do you want to spend? Okay? Now, if you're poor, well, you're left with very little choice. So that's one downside. Then you've got to wait to get the money reimbursed. Okay? Now, if, for instance, you have cancer and it requires surgery and MRI scans and all the rest of that, you're going to have to wait quite some while to get the money back. And again, if you're not very wealthy, that's a bit of a stretch.
But you can have insurance for that, though.
Well, that's what I'm saying. You make a claim against your insurance, but then they take some time. It has to go through their bureaucracy because everyone is using insurance companies to do this.
But you know how it is here. We have private insurance where you pay the insurance, and as soon as you're diagnosed with cancer, you get the full treatment. But because you paid the insurance, you're not then paying.
You jump the queue.
Well, you're going to a private hospital, I suppose, and therefore you're not jumping an NHS queue because you're not going to an NHS hospital.
Plus, the private medical companies in this country, Bupa, whatever, they don't train their own staff. They basically let the National Health Service, the taxpayer, train the people, give them some of the best training, a doctor 7 years, a surgeon even longer, and then they just take them on.
Yeah.
Right. So their business model
Well, the NHS does the same with third world people, doesn't it? It takes trained nurses from developing countries without training them, doesn't it? And doctors. No?
It does both. It sometimes takes people who are coming to this country and may return to their own country, or it recruits people who've been trained in their own country and are experienced. It depends.
We've hoovered them up. Around the developing. Look, your point is still valid. Your point is still valid. I'm being slightly sarcastic. What I'm getting is, I think it's a fair point to say, private health organisations should pay into a fund to contribute to the training of the people who they are receiving already trained.
Labour Party policy.
Fair enough. So you can make these points and they're valid points, but nonetheless. An insurance model whereby once you're diagnosed, because you've been paying insurance, you then get the treatment in full without shelling out loads of money, as you say they do in France. That's operative here, so it could be operative as part of a model alternative to the NHS.
Well, except it's not going to get off the ground because no one is going to include it in the manifesto.
Oh, look, I wouldn't challenge you on that because realities are realities. You know what? Here, the only realities I speak about are Catholicism. The rest is unreality, like we've just been discussing now. What if?
Well, I think you're making a category error there.